So again, I'm Robert Phillips. I'm with the Sierra Health Foundation, and I am, if you have to think about the presentations you heard today on health from Dr. Eiten and Dr. Rudolph, it's you're going to tell them what you're going to say, then say it, and then remind them what you said. I'm reminding you of what was said earlier. So I'm going to blow through this quickly so I don't dwell too much and so we can actually get to the conversation. But I just want to talk about the Healthy Sacramento Coalition in context and start with a quote, because when we think about health, as you heard from both Tony and Linda, we think about it in a really broad context. So health isn't just health policy, it's really social policy. And I start with this quote to remind me of that because of who said it, not as a health conversation, but as a social policy conversation, right? That it really is the experiences of our lives that make up who and what we are, but also determine the term of our life, right? And this is something we've known for 50 years. This isn't new, and he knew this prior to that. So the work that we're engaging in is really building off that notion, but it's also a recognition of a criticism of the way we've gone about this. And I don't mean a criticism of the war on poverty and all these things in a market sense or a conservative sense that, you really need to kind of let the market determine or individual kind of impetus kind of drive this stuff. I mean in the sense in the way that you actually go after efforts. That we've had all of these things, but the way in which we've done them, we still have, at the end of the day, low life expectancy or differences in life expectancy for different populations. And we also have what we call, and you've heard a good deal of, inequities or in the determinants of health, right? These health disparities. And it's largely because we've gone after work this way. And this is more of the, I would say, at the time when Lyndon Johnson had his quote, King also had a quote, that you can't fight a war on two fronts because you piecemeal out the solutions. And this is the result, that we've had a good deal of progress in all of the arenas that we've had, but the progress has been isolated. It's not been comprehensive. And I would say that in the work that we do in neighborhoods and we do in space, the work that you do across human service systems or education systems or health systems. And this is what you get. So this is another way of saying what Dr. Eiten and Dr. Rudolph has said. You get differences in life expectancy, and not just early in life, but in the middle of life, and also at the end of life. And so the question is, how do you actually not continue to do what you've always done? How do you think about it differently, right? How do you actually take a comprehensive approach so these lines actually begin to equalize, right? That we know that life expectancy isn't just tied to all of the things that make us up, but health policy is social policy. So when people talk about development and reducing poverty, they're also talking about well-being. And that's where we are too. When people are talking about education and life expectancy and earnings, they're also talking about health. So the question for us here in Sacramento, that 82 organizations have, some who are in this room, kind of bonded themselves together around from multiple disciplines, multiple perspectives, multiple communities, is can we come up with a comprehensive approach to health in Sacramento? That's what the Healthy Sacramento Coalition is all about. So instead of these individual sectoral approaches, the question is, can we bring them together to actually have these outcomes, right? Folks are ready to succeed in life. Folks are actually healthy in the broadest sense of the term. And people are engaged, which is also, for us, an indicator of health. So how are we going about doing this in the Healthy Sacramento Coalition? How are we thinking about this work? So this work, the impetus for it started with a community transformation grant, which you've heard about in here, from the Center for Disease Controls and Prevention, but has been expanded upon. But what does it actually mean in Sacramento? And first is, prevent the leading causes of poor health in Sacramento County. Pretty simple, right? But the second is making sure that these changes actually improve health. Not that you just close gaps, but that you actually have the presence of well-being. And you have that in a positive way. We do this in 4 ways. Because when you talk about this work, it's not enough to just knock on doors. It's not enough to just provide service delivery. It is we have to change the way we do things around here, right? And that is you do it through the environment. For us, that is how and where we live, right? The conversation that we're having today. You do it through policy, the decisions that we make that codify that. You do it through the programs, all the things that we kind of engage in to express, right, the best of ourselves. And we do it through the systems, which is basically those things that help us kind of operate how we want to do things. The focus for us is pretty broad, intentionally so, because we know that there's a lot of things that determine our health. But there are three things that we are putting our shoulder behind. One is tobacco-free living, because we know how that impacts our health. But the second two are really the ones that we are, I would say, emphasizing heavily, which is this notion of active living and healthy eating. And you've heard a lot about that. That's the environment for us. That is space. That is how and where we live. And then this other one is the healthcare, right? How do we actually integrate the things that we know in healthcare with the things that we know in communities at work? But putting real emphasis on this notion of social and emotional wellness. And when we have a discussion, I'm going to talk about this, how it relates to this work, particularly around this notion of biodiversity and aesthetics and health, but also having healthy and safe physical environments. I won't spend too much on the time on the goals, but I will spend some time on these principles. One is that we are taking an early interventive approach, a preventive approach. So you've heard Tony talk about this, is how do you actually get ahead of the conversation rather than reacting to what is? And the coalition's goal is really to kind of get into that conversation. You've heard a good deal about equity, but the question for equity for us is, as an example, if you think about the cutouts in sidewalks, right, that are the result of American Disabilities Act, that are really for mobility for folks who have difficulty getting around, that those cutouts don't just benefit folks who have a disability, they benefit us all in some way. So how do you take a really targeted approach and have a universal impact? And that for us is the equity question, as well as expanding kind of the evidence base that we're up to. And using that to really kind of hit this broadening focus that we've talked about earlier, that you've heard from both Dr. Rudolph and Tony. For us, though, it really is to get to that question of focus, that through our work, we know there are 15 zip codes in this county that experience the health outcomes, educational outcomes, economic outcomes, just well-being outcomes, that we're focusing on to actually test our concept, right? If you can improve health in these communities, can you improve health for Sacramento County? And using it as a way of building on what they have there, but being very, very sensitive to the challenges that they have, as well as the opportunities that are present there, as well as those challenges and opportunities within the context of Sacramento County. And so for those who are curious and are more literal in terms of looking at numbers, here's one way of thinking about the 15 zip codes. There's North Sacramento County, South Sacramento County, and downtown. And then those who like maps, that's what we're talking about. And so the reason why we're prioritizing these neighborhoods is, you've heard of me, talking about the compelling data, but also the cost of not addressing this, but also capacity, right? How do we leverage what we actually have instead of dreaming or idealizing what we can do, using what we actually have and targeting that? But then using the other efforts that are existing in Sacramento County. As we know, there's a good deal of work happening in Sacramento County. A good deal of that work actually is rooted, though, in these neighborhoods. So how do we leverage those efforts? And it's a conversation we should have in here today, because a good deal of the work that you all do are also rooted in these neighborhoods. How do we actually help each other build on and move forward on the work? So we've been meeting for a while, so this is kind of where we've been. Over time, we've done a good deal of work and have a time limited, or at least in terms of our effort to date, have a time-limited sense of we have to accomplish something within 5 years. So that is our kind of orientation, at least for the time being, is in 5 years we have to move something to at least show some progress, but also demonstrate in Sacramento that it can be done, and it can be done in coalition, not be done just through individual impetus or through issues, but you can take a comprehensive, a broader approach and do something together. And so we are focusing on these results in order to hit these targets in 5 years, using data, surfacing challenges and assumptions about how does it actually work together and work in these communities. The other thing, though, was that we're being clear on what's the difference between quality of life outcomes, like life expectancy, and then what people actually do to get towards them, so we can know what we're actually hitting. And this is how we're structured. So it took us a good deal of time to get here, but it also gave us a structure that's porous enough to allow a lot of perspectives to come in, but to be focused in a real strategic way. And this is what we're hoping for at the end of the day. How do we make the healthy choice the easy choice? So with that, I will stop.